We are delighted to be back for another episode of It's Not That Simple from the Francisco Manuel dos Santos Foundation, where today we're going to be exploring a topic that really should interest everyone listening or watching this episode. We are going to talk about life expectancy and life quality. We all want to live as long as possible, right? We all want to live our best life. So how can we do that? That's exactly what we're going to discuss with today's special guest, Dan Buettner, who is a renowned explorer, National Geographic Fellow, award-winning journalist and producer, and New York Times best-selling author as well. Dan, I could go on with your resume because it is quite impressive, but I'll bring you in here and introduce the topic of the blue zones, which are 5 areas on our planet that you've been able to identify as places where people have not only the longest lives, but the best versions of their lives. And before we explore this topic in more depth, and of course it's something which I had an opportunity to watch on Netflix recently, and I know a lot of people who are interested in this topic have been following your work for several years now. But let's start with a basic definition of what the blue zones are and what characteristics that they have.
Yeah, I think it's useful to start with the genesis. So the idea was to, in a sense, reverse engineer longevity, knowing that only about 20% of how long you live is dictated by your genes. The other 80% is something else. My colleagues and I at National Geographic reasoned that if we could find the statistically longest lived areas in the world, in other words, people who achieve the outcomes we want, and look for the common denominators, we'd have a pretty good idea. And so the first step was identifying these places where people live the longest. The way we measure it is they have the lowest rate of middle-age mortality and or the highest centenarian rate. It's usually an and that took 2 years, and it was a result of careful analysis of worldwide census data and then actually confirming the ages. Other efforts hadn't taken that extra step of confirming ages. And once we have these populations who've achieved the outcomes we want, which is a long life, largely free of chronic disease, then we went about using anthropology and epidemiology and foot leather, shoe leather, investigative journalism work to try to piece together the formula for reaching the capacity of the human machine.
There's so much to really explore here, but I did want to talk about these 5 areas you were able to discover from the research that you and your team conducted, and the relationship between the lifestyle, the environment, and the longevity. So what can you tell us about what these areas had that others didn't, and what people were doing right?
Most of the blue zones are remote. So just very quickly, Okinawa, Japan, home to the longest lived women. In fact, the longest lived human population in the history of the earth. Sardinia, Italy, the highlands, an area known as the Nuoro province in Ogliastra, they have the highest concentration of male centenarians. On the island of Ikaria, Greece, you have a population of 10,000 people, live about 8 years longer than Americans do, but no discernible dementia, which is a major source of premature death and also premature vitality. In the Nicoya Peninsula of Costa Rica, very poor area, by the way. They spend 1/15 the amount we do on healthcare, and they have half the rate of middle-age mortality. And because our editors at National Geographic wanted to find the American blue zone, we found one among the Seventh-day Adventists in Loma Linda, California. And all of these places, to answer your question, tend to be remote. They tend to be off the beaten track, largely left alone throughout history to incubate a unique lifestyle that there may be some randomness into it. I believe there's some evolutionary sort of trial and error or natural selection at a societal level that produces remarkably long life expectancy and through the same techniques and same factors.
Now, when you talk about the what health is, what well-being is, today we're bombarded with a lot of information about diet, so nutrition, and exercise. And from other interviews I've seen, you've talked about how there really shouldn't be too much of a difference of how people lived and exercised 30 years, for example, how they're exercising and living now, but there's a drastic change in the level of disease that we see, and there's especially a big difference in the way in which today's society is counting more on medication than ever before. What can you tell us that people are doing wrong in a lot of the modern and developed world that in these remote areas they're not?
I'd say putting too much emphasis on diet and exercise. I mean, in America here, it has been a priority. It's heavily marketed to us. It's a multi-billion-dollar industry, and for the most part, it's not working. America continues to be plagued with chronic disease and diabetes. In blue zones, people aren't exercising in the way we exercise, yet they're still making it to age 100 at the highest rates. They're moving naturally. They're not trying to live a long time. They're making the right choices on a day-to-day, moment-to-moment basis because their environment nudges them in the right way, and that's the way I think we need to be thinking.
Yeah, because I think it'd be fair to say not only in America, but increasingly around the world, we're all tempted multiple times by fast food, and the availability and the comfort that comes along with that choice is very difficult to resist sometimes. Obviously, you've done a lot of work now in North America in partnership with governments, employers, health insurance companies, and you've tried to implement blue zones in different regions. Tell us about that project and how it's gone and how it's worked.
Yeah, so just to get back to this point of changing people's environment, in the United States, since 1980, we've seen obesity rates triple from about 15% to 42%. Rate of diabetes has gone up by a factor of 7. That's not because people have somehow degraded or they lack discipline or they're lesser people than they were 40 years ago. Our environment has changed. The number of fast food restaurants has gone up exponentially. You cannot escape cheap calories, processed foods. The amount of time we spend in our automobile has about doubled. So that's time we're behind a wheel and not on our feet. In blue zones, people are walking, they're eating basically whole food, plant-based. The 5 pillars of every longevity diet in the world are whole grains, greens or garden vegetables, tubers like sweet potatoes, nuts, and beans. I would say if there's one longevity food, it's beans. It's associated with about 4 extra years of life expectancy. People aren't lonely in the blue zone because every time they go to work or a friend's house or out to eat, it occasions a walk, and they're bumping into their neighbors. They're expected to show up at festivals. We know that if you're lonely, it shaves about 8 years off of your life expectancy as opposed to having 3 good friends. Now, if you live in America and most parts of Europe, these things do not come naturally. In blue zones, they do because it's an outgrowth of the proper environment. So if you begin with that lens and you look at any American city and you start saying to yourself, well, how can I change comprehensively this city so people are nudged into moving more, eating less and eating more plant-based, socializing more, and knowing and living their purpose? We've developed a team. We have a full-time team of about 150 people. One part of that team works with city government to identify and get consensus around policies that favor healthy food over junk food, favor the pedestrian over the motorist, and favor the non-smoker over the smoker. And if you come in not telling governments what to do, but rather identifying the policies that, number one, are feasible and number two, are effective in that area, you can get a lot implemented in 5 years. And then we go through and we certify all the restaurants, grocery stores, workplaces, schools, and churches that are willing to optimize their environment to nudge people to move more and eat better, et cetera. And then a third squad goes in and works with about 15% of the adult population, not to hound them or guilt them to change their diet or to, start running marathons, but to re-curate their immediate social circle, because we know what our friends do has an enormous impact on what we do. So rather than changing your lifestyle, we change your social network, because that's a constant nudge and it measurably impacts your health behaviors, and then how to set up their home. So the common thread to all three of these is we don't try to change people's behavior like everybody else does. We change their environment to set them up for unconscious success. And in every one of our 73 cities, we've seen the BMI go down, and Gallup measures the BMI at a set point, and then every year thereafter. Well-being goes up, the amount of physical activity goes up, vegetable consumption goes up, and we're in America, we can't sell our program on health alone. We have to sell it on economic indicators. And in Fort Worth, Texas, for example, a city of 1 million people, our work occasioned about $250 million savings from projected healthcare costs. So we were able to pay for our program several times over. And I think it's a good model for other countries to consider.
Wow, well, congratulations for that. And you mentioned other countries, and I have to bring in Portugal. I know you've been here a few times. Our diet, I would say, is similar to the Greek, right? Where you found one of the blue zones, the Mediterranean diet. So we are predisposed to have perhaps an advantage over the American public, depending on where you go. But in general terms, if the people responsible for the government of Lisbon, let's say, we're going to come to you and say, Dan, traditionally we're reasonably happy with the way that people have lived, that people have conducted themselves across nutrition and across health, but we've noticed some issues over the last decade. What can we do to improve? We want to get back on track. How does that work? How does your work relate to advising these local governments on the pathway they should follow?
First of all, the government has to want us. So our approach necessarily requires a government willing to limit freedoms around unhealthy choices. And if they're like this, we can't really help. So our process would be to come in and do an assessment and talk to the mayor and whatever sort of city council's in place, the CEOs, the local, both official and unofficial leaders, to see if there's an appetite. We find most of the time there is an appetite, and then it's getting everybody at the table agreeing that we're going to measure this at the population level. And once you come in with a good metric, you can usually get stakeholders to come in because it's measured. And then the key, this is the big key. You don't come in and tell city council what to do. You don't necessarily advise them. You come in and you show them menus, policy menus, evidence-based, that have worked elsewhere. And the concession or the commitment you need to extract from them is they're going to sit down and go sit with your team of experts to look at each policy for effectiveness in Lisbon and feasibility in Lisbon in 5 years. And every time we'll go through 30 policies, a half a dozen float to the top that would we not even considered. And you can get a lot done that way. And then it's just the certification process is just foot on the ground, going to visit every restaurant, every grocery store, every workplace, every school. And if you have a full-time staff working for 5 years, you can get to every one of them. And it's not until you take that comprehensive environmental approach that you're going to change anything. Every other project that has tried to make a city healthier by trying to convince people to change their behavior has failed. The National Institutes on Aging tried 6 of them in the 70s, and they all failed. That's why the U.S. government doesn't fund these things anymore. So we tried to, take a different route, an environmental route, and so far it's working splendidly.
When I hear you talking about these programs, I do think a little bit of the fountain of youth, right? All of us would love to have access to some kind of magic formula that can make us live longer. But it's not just about living longer, it's living our best life. Do you think that people are a little bit too obsessed with just the amount of years rather than the quality of years? And how do you try to maybe add value to the conversation of it's not just whether you live to 90, but how did you make it there?
Yes. So I applaud the innovation in Silicon Valley in the United States with these genetic interventions and these billionaires wanting to live to 150. And
Yeah.
but in many terms, they often just prolong a crappy life. And what I noticed in these blue zones, the way people are making it to 100, you alluded to this in our introduction, they know their sense of purpose and they're living their sense of purpose. They're social. And by the way, those two things, we know that people wake up with a strong sense of purpose, live about 8 years longer than people who are rudderless in life. If you could put that in a pill or supplement, it would be $1 billion blockbuster drug.
Yeah. Yeah.
But nobody can make money at purpose, so it's not marketed to us. Same thing with loneliness. Loneliness shaves 8 years off your life expectancy. It's as bad as a smoking habit. If you can orchestrate your life so you're surrounded by people who care about you on a bad day, whose idea of recreation is gardening or pickleball or bicycling or playing golf, you're going to do those things naturally and with joy. Focusing on your family. We see that very clearly in blue zones. That's a priority. Aging parents are kept nearby so they have a nice older life connected to their grandchildren. The thing is, the way we make money in America here is by selling you something that's going to make you less sick, whether it's a pharmaceutical company, whether it's a doctor giving you a procedure, whether it's a hospital who wants to rent you a bed. So you have to be very careful when the incentives are misaligned with the outcome we want. Mm-hmm. The incentives in America, for the most part, are count on getting you sick and then fixing you later. And what we're trying to do is find a business model for getting paid to keep people healthy in the first place. It's a little easier to do in Europe, by the way. Your healthcare system is better aligned and I think more open to this sort of thing. And by the way, Costa Rica has a very good program that Portugal might take a look at. That's their basic health teams where every man, woman, and child in the country has the right to one visit a year from a member of a 5-member basic health team who shows up to your door with your health records, can screen you for diabetes, for heart disease, for depression, and catch a major chronic disease before it blows up and it's a $100,000 problem in the emergency room. We don't have that in the United States. If the economics of health in this country, they want you to show up in the hospital with an expensive disease because that's where the money is going to be made. I'm not saying there's anybody bad here. I'm just saying the incentives have been misaligned for 60 years here, and it's so hard to fix this entrenched system now that we have to work around the edges. But
no doubt about that, and that's a very interesting model in Costa Rica, no doubt about that. Now, obviously, throughout your career, you've done documentaries, you've written books, you've done a TV series as well. What's the importance, especially in today's digital age where everyone is bombarded with so much misinformation and overinformation, for you to be out there and trying to cut through all the speculation, cut through all the hype, cut through all the propaganda in a way, with science, with facts?
Yeah, and you not only need more than science and facts, that you have to somehow dazzle people. I mean, this Netflix documentary that Living to 100, which is done very well. It's done very well because we hired a team that produces absolutely top production values. I called it longevity porn. In other words, I wanted to make Looking to 100 sexy. And because beings aren't sexy, socially connecting aren't sexy. knowing your sense. None of this stuff is sexy. What's sexy is shooting yourself up with, a child's blood or, cracking some genetic code. But that so far hasn't worked. What's working today are these time-honored lessons we get from populations that are living the longest. And you not only have to underpin it with science, and I work for National Geographic, and the fact checkers occupy the corner office. We're very buttoned up. And then you have to make it look gorgeous, and you have to make it look aspirational.
Yeah.
Unless you have those two, it's hard to get people to pay attention.
So here's the $1 million question. How old do you want to live until? Are you going to make it to 100?
Well, I've actually done the math, but so by the way, everybody listening right here, right now, if you have an average set of genes and you do everything right, if you're a female, you should be able to make 95, and if you're a male, you should be able to make 91 or 92.
Wow.
And I think I'm in that category of making 92. I'm 4 decades away from my potential death. Since 1840, life expectancy has risen 2 years per decade. So given my life expectancy is 92, I have 40 years left. If we get those extra 2 years per decade, I should make it to 100.
Yeah.
And I'll be very happy with 100. And then I'll be very happy to get out of the way and let somebody from the next generation take over this work.
Look, before we get into the quick fire section here, I did want to also ask you about what a longer life means for all of us, right? Because does that mean that we're going to work longer? Because what did you notice in the blue zones as far as, you mentioned the communities and the importance of that, and I've seen it in my own family. I was away for 20 years on and off, and my mother's health wasn't great when I returned, and I've seen a drastic improvement there just by being around and having family around. I've definitely seen that. But then there's the work area of it as well. And what do you notice out of the extra years that we have and how long we should stay busy, right? Because you mentioned purpose, and there's the personal purpose of family, of friends, of community, and then there's the professional purpose. What have you noticed around that? Because I know you're busy, so how do you correlate that, and how do you see an extra 40 years then of work or not?
So the first thing, people say, I don't want to live to 100. Actually, you do want to live to 100, because the cohort of people who make it to 100 only suffer about 6 months of morbidity, at least in Okinawa. In other words, they die pretty quickly in their sleep. The cohort who dies at age 60 are suffering about 8 years of morbidity. So you want to live as long as you can. The longer you've lived, the healthier you've been. So first of all, in Okinawa, for example, they had produced the longest lived population in the history of humankind. They don't even have a word for retirement in their vocabulary. Instead, one word, ikigai, the reason for which I wake up in the morning, imbues their entire adult life. And I think that's the way you want to live. You want to identify what you love, what you're good at, and what you can give back. And ideally, that's in a job you're doing. But if it's not in a job you're doing, it could be unleashing that in your family or with some sort of volunteer activity. But it's really important to get clear on your purpose and putting that to work. I ask the question of every centenarian I meet. I've interviewed 350 of them. How do you make your third act count? And it's always some variety of find something you love and find a way to be useful and give back. And I think those are sort of guiding lights for making the most out of it. I went to something called the Modern Elder Academy, which is a great place to find your purpose. And I met an 85-year-old guy who was still writing screenplays. His name was Jim, and writing a novel and writing a TV show. And I said, well, what drives you, Jim? And he said, at a certain point, I realized that work is more fun than fun. And I think that's where you want to get when it comes to the third act.
No doubt about that. And if you can make work where it's not work, obviously that's a huge advantage if you can have fun doing it. Dan, I'm going to be selfish here for maybe a minute or two, and I'm going to, since I have access to speaking with you here, and it is a privilege, I'm coming to you and I'm saying, okay, I want to live longer, so I need to move, I need to eat largely a plant-based diet, and I need to have a community around me in order to be able to do that. Is that in a nutshell 3 key pillars of being able to guarantee it?
I'll put a finer point on all of those. Number one, a plant-based, you want a whole food plant-based diet. Essentially, you want a peasant diet, and you can go to any village in Portugal and see how their grandmothers ate, and you're going to be pretty close to that.
Okay.
Number two, you want to curate your immediate social circle. And I wouldn't necessarily tell you to dump your old friends because they may need you. But I would say that if you could bring on 2 or 3 friends whose idea of recreation is something physical, people who truly care about you on a bad day, and people who are already vegetarian because they're going to teach you how to find and eat good plant-based food. And then get clear on your purpose and make sure that if the job you're doing now isn't providing your purpose and you don't absolutely need that income, or you can find that income doing something that fuels your purpose, you should quit. And the easy cheat for all 3 of those is usually moving. If you're not finding your community in Lisbon, move down to Albufeira or something where it's a smaller village and it's easier to make human connections and it's easier to walk places. We know, for example, in the United States, there are zip codes in Kentucky where life expectancy is 20 years less than they are in walkable Boulder, Colorado, where you have easy access to recreation and easy access to good food. So moving is actually a very good strategy for living longer.
Well, I definitely feel privileged to get that advice from you, and I'm sure everyone watching and listening do too. We're going to wrap up with a quick fire. Okay, I've got 4 questions and 1 word or 1 sentence answers, please. So first is, what is 1 personality trait that a good leader could really benefit from having?
Passion.
All right. What is the biggest challenge that humanity is facing now?
Too many humans.
If you could change 1 thing about the planet, about humanity today, what would that be?
The polarization, bringing people together.
That is
around a common cause.
Yeah, increasingly polarized this society at the moment. And what is the most important learning of your life?
The realization that my purpose lies in finding the traditional peoples of the world, taking the time to learn from them, and then spreading the wisdom that they have taught me. That's been the backbone of my professional life for 40 years.
And it served you well. Dan Buettner, it's been an absolute pleasure to have an opportunity to discuss a life, longevity, quality of life with you. Congratulations for everything you've been able to achieve. And yes, those 3 Guinness World Records as well, that obviously we didn't get a chance to get into today. But all the best, continued success, and hope you continue to preach the word, and humanity will thank you for it.
And we'll see you when you're 100.
I don't think it's going to happen, but Dan, all the best. Thank you so much.
All right.
Dan Buettner, such a fantastic opportunity to have a chance to speak with him about life. I mean, that's what we're all involved in here, and get to know more about the Blue Zones, what makes them special, and what we can learn from them as well, how they can be replicated in various areas of our society as well. So hope you enjoyed another episode of It's Not That Simple. See you soon.